Hey friends, this week's body signal is about runner's knee. So with all the awesome run clubs in downtown Sarasota, you're putting the miles in, you're up leveling your fitness, which is amazing. But if you're running on concrete all the time, you have the improper shoes, muscle imbalances in your leg, or even a pelvic and hip misalignment, this one's for you. What causes runner's knee is when the femur stacks on top of the tibia and it misaligns, primarily to the front. And when it happens, when that medial or inside aspect of the femur rotates forward, it changes that Q angle. So it's going to increase the Q angle. So it changes how your leg is hitting the ground. And there's forces coming up from the ground up the kinetic chain. So if you're angled here, okay, those forces are going to manifest in certain areas where they shouldn't be, primarily with the kneecap here. So runner's knee is pain caused by the patella or kneecap rubbing against a forward rotated femur. And that closes in the space where the patellar groove is, and then that kneecap keeps running every time you're taking a step. And the problem with that is it creates a lot of wear and tear and ultimately leads to a breakdown in the tissue, osteoarthritis, and other problems there, especially with the medial meniscus, because when we increase that Q angle, it puts more pressure and more weight bearing on that medial meniscus here, which can cause a lot of wear and tear. So what we do in our office is a thorough 4-step evaluation where we're going to visualize, we're going to get some hands-on feel where the inflammation is in the pockets of fluid. We call that intra and periarticular swelling. And we're also going to take some images of your knees weight bearing where we can actually draw some lines and measure it out and see exactly which one's misaligned and which one wants to be worked on.